Thanks for joining us today. Welcome. Good morning, good evening, good afternoon. I know we have some audience members from all over the place. Thank you so much for joining us. So I'll give us another minute or so to get on the same page and join and get comfy. All right, so welcome everybody, and thank you for joining us today as we discuss how we can decarbonize homes to support healthier communities, particularly for ones that bear the heaviest economic, social, and environmental burdens. Before we jump in, I'd like to take a second and remind everybody of the respectful and inclusive dialogue that we would like to have today, and for you to keep that in mind during our discussion. The agenda for us today, we will hear some opening remarks before exploring some of the findings from our recently published report. We will then have a discussion with some of our guest speakers, and we will then conclude with a question and answer segment. A reminder that this event is being recorded and it will be accessible after we finish. And we would love to hear from you through your questions or feedback. And you can submit these at any time through the Q&A box, which should be at the bottom of your screens. If you had any technical difficulties or other requests, you can also put that in the same box. We will hold these questions to answer live during our Q&A segment, and we will try to get to as many as possible. So this work would not be possible without all hands on deck. We will first hear from Crystal Bergman, Senior Advisor for Climate in the Office of the Secretary at HUD, and she will kick us off with some opening remarks on how the relationship between buildings and health, while ensuring equitable outcomes, is being recognized at the federal level. Please take a look at this quick video.
Hi everyone, it's so great to be here today. I wish that I could be there live, but I appreciate the opportunity to speak to this group doing such important work. My name is Crystal Bergman. I'm the Senior Advisor for Climate in the Office of the Secretary at HUD. And at that role, I work to coordinate our climate and energy work across HUD's programs to ensure that we are maintaining our focus on equitable climate action in both adaptation and greenhouse gas mitigation, as well as our focus on environmental justice throughout these priorities. For the first time ever, the federal government is offering a full court press on climate action. In January, President Biden issued an executive order on tackling climate at home and abroad, rejoined the Paris Climate Accord, and declared national climate goals with an aggressive but achievable focus on bringing economy-wide greenhouse gas emissions to a net of 0 by 2050 and cutting emissions in half by 2030 from 2005 levels. We know that many of those emissions will come from other parts of the economy and other sectors, but we know that in order to hit our targets, transformation at the building level is going to be critical. HUD plays an important role in mitigating climate change by reducing greenhouse gas emissions due to its portfolio of over 4.5 million units of public and assisted housing units, and our role broadly in the development and preservation of affordable housing. HUD spending on utility and public housing consumes as much as 14% of HUD's budget and produces an estimated 13 million metric tons of carbon emissions. We know that we need to make a difference here and we need to make an impact. At the property level, Making a difference will mean energy efficiency, smart buildings, and holistic and equitable decarbonization. So we know that we need to work beyond just electrification, but ensure that weatherization policies and equitable decarbonization is something that is the norm at HUD. At the property level, we're making a difference, and our biggest and most ambitious programs now are included in the Build Back Better program, such as a supersized multifamily green and resilient retrofit program, and much needed funds for public housing retrofits. But while that continues to be debated and we wait for the passage of that bill and the FY22 budget, we'll continue to work hard on some of our core programs around energy efficient building codes, energy efficiency incentives, such as the Green Mortgage Insurance Program. At the same time that we race to limit our greenhouse gas emissions across HUD's housing stock, we know that it's clear that climate change is here no matter what we do, and the impacts are going to be with us for decades. And we know that climate impacts are worse for vulnerable populations and underserved communities. So we already require our CDBG recipients to incorporate climate hazards and risks into their consolidated plans. And we're working to develop more tools for states and localities and property owners to make sound decisions with regard to resilience planning. With HUD's assisted and insured portfolio, we can't manage what we can't measure, so we'll be working on agency-wide benchmarking on a large scale to make sure that we're assessing our risks, including our climate risks related to both physical and financial risks. So the next 18 months, we'll see a wholesale effort to gather information, map properties, develop models, and understand how we're going to incorporate that work into our underwriting and asset management projects. We have a lot of work to do. We're working on wholesale understanding what our role and our problems are, and also working to find some ambitious solutions. We know that climate justice is important and climate equity is critical to this work. So I look forward to working with all of you joining this call on making sure that we have equitable housing as we approach the climate space. Thanks very much. Bye-bye.
Thank you again to our friends at HUD. So let's get started. Hi, everybody. My name is Yuan, and I'm one of the authors of our report, Decarbonizing Homes, Improving Health in Low-Income Communities Through Beneficial Electrification. I will also be your host today. Joining me is my co-author, Bomi Jung, and we will first hear from Bomi as she takes us through the significance of this work, why we are asking these questions, and what we hope you may take away from our chat today. Bomi, over to you.
Thanks, Yuan. And I want to thank everyone for joining us, and for RMI for sponsoring this paper and also hosting this event. If we can move to the next slide. So, we approach this paper and the need for this paper from a perspective of really thinking about how do we center climate justice in these discussions. And I think it comes from a place of saying, well, we've been doing energy efficiency work at this point for several decades. And yet there's, I think, a palpable sense that there's work going on that's mission aligned, but isn't really connecting. And this is an opportunity to move that forward in a substantive way. And our starting place is really that change is coming, and we have to decarbonize buildings quickly, and we know that. So how do we take that as an opportunity to maximize the health benefits, particularly for underserved communities? And this is the conversation that we were trying to spur by doing this report, and the conversation that hopefully we'll be having today. Next. I'm sorry, just a quick tech check. I'm not sure that I'm on screen, but I will move, but I'll keep going. So just in terms of just doing some context setting, it's important to start, I think, with the context around housing and housing cost burdens, because the cost burdens, are so central, to so many other things that happen in the life of a family, including around health. So, I think we need to start by understanding that something like a third of households in the US make $25,000 or less a year and pay more than 30% on housing costs. So right now, the level of housing cost burden is really unprecedented. And that is an underlying truth that we need to start with. And then on top of that, not only is the rent burden high, and not only is it higher for low-income families, in addition, the housing stock itself in our country is in a state of disrepair and in need of a lot of investment and a lot of ongoing investment. Next. And when you look at the kinds of, when you look at how the needs break down, as you might expect, it's that there is a correlation between low-income families occupying homes that have more dire needs. So not only is it the case that 2 in 3 homes that have substantial quality issues like mold and mildew and structural issues, not only are 2 in 3 of those homes occupied by low-income households, nearly 80% of units that are lacking essential components like working kitchens, like working heat, are also occupied by low-income families. And so housing quality as a whole is a really central issue in the debate alongside housing cost burden when we think about where we are in the built environment. Next. And then the third fact that we start this report with is that we have a housing stock that is largely dependent on fossil fuel for heat and for hot water. This is especially true in the cold climates in the Northeast and Midwest, but there's gas heat pretty much across the country. And RMI's findings have shown that low-income families, due to a variety of factors, tend to be overrepresented in terms of the buildings that are using gas. And so, when we look at the the health literature corollary of that, what we find is that PM2 exposure, so exposure to the pollutants that result from combustion, is those health impacts are some of the most inequitably distributed impacts. Next page. So at a very high level, the key messages that we'd like to see get propagated in the conversations in the field are these. Number one, that when we talk about electrification, we should really be talking about beneficial electrification in a way that encompasses housing quality, in a way that encompasses housing cost burdens. So electrification simply just means that we're switching fuels, but how you switch that fuel and how you make those decisions are really important, because at the end of the day, the outcomes that we want to have when it comes to homes is to help buildings do, and homes in particular, do what they were designed to do, which is promote healthy indoor environments. So really, the key to beneficial electrification is to make sure that housing quality and housing cost burden are included in what we think about when we think about electrification. And then the second message is that health benefits to low-income communities are going to be really substantial, right? And so, and this comes from a really robust set of health research, public health research, that have identified the ways in which housing quality really is integral to health. And we go into that in the paper. And the third point is that state and local governments really ought to be taking action on this today, and that they're in a position to be able to lead. And so on the one hand, it's fantastic to see Crystal in her intro to this event talk about the investments that are being made at the federal government level, but particularly when it comes to things like codes and how we incentivize affordable housing, and these rulemaking that really impacts how affordable housing gets built. Those are more often than not dependent on state and local action, and things that state and local governments can move independently even of the federal government. So understanding that we have that lever, I think, is really important. Next. So in terms of this term, beneficial electrification of housing, beneficial electrification really is a term that has its roots in the utility sector. And it's still, I think, most often used by utility regulators and utility sector people. But basically, the fundamental idea is that there are ways in which electrification can have benefits beyond just the benefits that are endemic to the utility system. And in a similar sort of way, what we're saying here is that we can look at electrification, but hone in on the ways in which the benefits go beyond just greenhouse gas impacts or the well-functioning of electric grid systems. And so here what we're offering is to encompass these ideas and about how to benefit particularly low-income communities by looking at it as a term that we can embrace not only in housing, but perhaps also in public health, to talk about a set of impacts that we want to have. So lowering cost burdens, improving housing quality with an emphasis on healthy indoor environments, and then also greenhouse gas reductions and improving how buildings interact with the grid. Next. And what we mean by holistic intervention is really centered on the concepts that we've developed over the past 20 years in the energy efficiency sector, thinking as a way of doing systems thinking around solving the energy efficiency issues in buildings. So really what we're talking about is the classic, build tight, ventilate right, and then in this case, don't introduce indoor pollutants in the form of fossil fuel combustion. So, I want to emphasize that this perspective is not about trying to understand, what is the incremental benefit of a single intervention. The argument that it's making is that there is a holistic standard of housing quality that we can aspire to, which I think, in the moment is encapsulated by the various passive house standards, and that we should look to achieve all of those benefits at the same time. So we're talking about envelope improvements, electrification of appliances and equipment, and ventilation and compartmentalization, and finally grid services as being the package of interventions that makes up beneficial electrification. Next. And as I started, what we're trying to do with this paper is to really foster the development of common ground among many disparate professional spheres. We all kind of need to be on the same page because on the one hand, the need is great, just in terms of, again, the housing quality and the housing cost burdens, as well as the urgency around climate change. But we also need to be on the same page because, frankly, we're talking about something that's going to be difficult to achieve, right? So on the one hand, I think everything that we talk about in this report is really about state of the industry and state of technology and state of research today. On the other hand, just the challenge of moving as fast as we can on climate action and to do it in a way that doesn't maintain systemic injustices into the future, that is a challenge that we all need to work together on. So hopefully this is a paper that'll contribute to fostering some shared language and fostering some interconnection among these professions that have to all work together. So with that, a little bit of context setting, I'd like to hand it back to Yuan.
Thanks, Bomi, for setting a great stage. So our report is organized into three main sections. In the first section, we synthesize existing research and analysis on various building level interventions to really understand how work at each level may impact the health of both residents and the community. Our second section is our effort to contextualize and understand how communities may face disproportionate economic, health, and social burdens because of a multitude of factors. Finally, we put this all together in the form of some recommendations for state and local actors to further this work. So, next slide, please. The mechanisms through which beneficial electrification can deliver health improvements are many, from indoor air and environmental quality to safe indoor temperatures during extreme heat and cold, and even increased energy security. I'll now take you through each one that we have identified. So the undesirability of introducing combustion-related pollutants in the home has long been acknowledged in health literature. Pollutants from fossil fuel combustion are linked to a variety of adverse health impacts, and in the table on the right, we have tried to demonstrate the extent of these health impacts that you may see from both a short-term or long-term exposure to these pollutants. Our synthesis of several health and housing interventional studies show that removing fossil fuel burning equipment and appliances in the home is effective as a pollution source control measure, and doing so would immediately reduce the risk of health harms such as decreased lung function, asthma incidence, brain damage, heart failure, cardiovascular disease, amongst many others. Studies have also shown that a combination of both a high-performance building envelope with compartmentalization and enhanced ventilation shows positive effects on indoor environmental quality. Well-sealed envelopes and compartmentalization help reduce pest infestations and the moisture conditions that often lead to mold. It also prevents potentially polluted outside air from coming in. And additionally, research is finding that high-performance envelopes have the added benefit of providing increased hours of safety, which is the maintenance of safe indoor temperatures during hot or cold weather. RMI did some analysis, and we compared a passive house standard building envelope to a code-compliant new building during a power outage in a cold snap. And we found that the passive house was able to maintain safe indoor temperatures 4 days longer than the code building. In our exploration, we also document the benefits of adopting all electric equipment and appliances and how that may increase access to air conditioning and the ability to mitigate the deadly effects of extreme heat events. High-performance envelopes can contribute to more efficient cooling and safer indoor temperatures, but they don't do it all. Modeling has suggested that they cannot fully mitigate the effects of heat buildup if we didn't have AC when overnight temperatures stay high, such as during a heat wave. Some RMI modeling of different cooling technologies during a heat wave this past summer in Seattle found that heat pumps are the most climate-aligned cooling technology while also being superior at maintaining a comfortable and safe indoor air temperature. The bonus of adopting all electric equipment and appliances in the home means that we can also cook without open flames through the help of electric induction stoves. And through this, we can avoid heating up of our space while cooking, which means that we also spend much less effort trying to cool our space down while simultaneously keeping our energy consumption and costs down. The evidence also strongly suggests that removing in-building combustion can have a positive impact on what goes on outside of our buildings. Combustion equipment in our homes, such as boilers, furnaces, and hot water heaters, are vented to the outside. And so the removal of these will contribute to better outdoor and neighborhood air quality. A recent Harvard study found that roughly 15,000 to 20,000 premature deaths every year are due to outdoor PM 2.5 air pollution from burning fuels in residential buildings. We will also be reducing the demand on what is, in reality, an aging, leaking, and risky gas distribution infrastructure. We are also now realizing that leaking supply lines and equipment in buildings are contributing to fugitive methane levels in cities. Methane is a lesser known greenhouse gas that can actually have more than 80 times the global warming impact of carbon dioxide. Finally, the combination of electrification and high efficiency climate appropriate smart technology gives us the opportunity to increase the affordability and reliability of energy access, which is a very important driver of health inequity. The reliability and affordability of energy access has an important impact on health. When households are unable to adequately meet their basic household energy needs, or what is known as energy insecurity, a wide range of health issues can occur, such as stress and mental health, to poor sleep, and cardiovascular and respiratory health. Other direct health harms, such as carbon monoxide poisoning, temperature-related illness, and even death, can occur when residents resort to alternative energy sources to meet needs when conventional methods fail them. In part 2, we identify how communities face disproportionate economic, health, and social burdens, and exactly why we need to center these circumstances as we decarbonize our building stock. Evidence shows that low-income communities repeatedly face stressors on multiple levels, and they experience both heightened vulnerability and exposure in comparison to more affluent populations. Some of the vulnerabilities we have identified include systemic racism, marginalization and discrimination, limited access to resources and the resulting trade-offs, as well as poor neighborhood and household conditions. These communities also must grapple with heightened exposure to location-based pollutants, such as power plants, highways, Superfund sites, climate risks, such as extreme heat, being located in flood zones, and in-home pollutants and allergens. Health research indicates that 60% of the burden of heart disease is directly attributable to living in poverty and its associated risks. We also learned that children under the age of 6 who live in homes that use a gas stove or oven for supplemental heat are 80% more likely to have asthma than children in homes that do not. Summer temperature differences between redlined and non-redlined neighborhoods also can approach up to 20 degrees Fahrenheit, and 70% of people living below the poverty line have significantly higher exposure to surface urban heat than those above the poverty line. The combination of these factors and disparities serve as sort of a magnifying glass for any impact, be it good or bad. For example, when the New York City Mayor's Office modeled the health and air quality benefits of electrifying its buildings, asthma emergency room visits were reduced by 10 times more in lower income communities than compared to more affluent communities, even though the reduction in pollution was similar. The fact is, the circumstances that these communities face are immensely different, and we absolutely must take that into account when designing policies. Bomi will now walk us through how that might look like.
Great, thanks, Joanne. Next slide, please. So the third part, we looked at making some recommendations for action. And again, because we really believe that we need to start today. Actions that we take today are worth more than actions that we take tomorrow or the year after, right, in terms of impact. So starting with what local governments can do today. I think we have to start with, again, the understanding that although housing policy right now is really largely centered on affordable housing subsidies, the number of households that benefit from targeted affordable housing subsidies is much, much smaller than the total number of households across the country who have housing needs or have high housing cost burdens. And so, when we think about how to use affordable housing programs in particular, we really ought to be thinking about them not as an end to itself in the sense of like, if we fix these housing programs, somehow we've fixed affordable housing for low-income people, generally speaking, right? But we really should look at them as a lever to move the entire housing market in ways that are beneficial for everyone, but especially for low-income people, right? So, what we see when we see affordable housing programs may cause us to feel like, oh, that's a specialized corner of the real estate industry. But really what we have is a big opportunity to move markets along in various ways. So next slide. So we have 4 categories of recommendations, and I'll just sort of skim over some of the highlights for them. In the first category, we talk about creating an empowering or enabling policy framework. And this really gets to this idea that when we're centering climate justice as a key goal in housing policymaking or in policymaking generally, we have a tendency to think about it in terms of who is benefiting, and that is certainly important. But we also need to move beyond simply thinking about direct benefits to thinking about supporting the agency of the low-income communities who are affected by the policies that are made, and to make space at the policymaking table for folks to be represented and their interests to be directly spoken to. And so in the first section, we have a couple of ideas. One is to institutionalize the commitment of participation in state and local policies, as New York State has done, for example, in New York State's climate law, which requires both a focus on providing benefits to low-income communities, as well as inclusion in terms of decision-making. And then secondly, to use the community development corporations and community development infrastructure that exists across the country, the 5,000 CDCs and CDOs, as a way of getting deep into the community and having community-rooted leaders come to the table to shape the conversations around beneficial electrification. The second category is really, again, about using regulated housing, so what we traditionally call affordable housing, to build construction market capacity and to move the standard on what we do in housing generally. So just a couple of examples of actions that could be taken in that space include things like requiring that all new construction affordable housing meet passive house standards by a certain date, for example, 2025. And this would mean that a particular market would get a clear market signal that this is a standard that is coming for this particular segment. And the sort of magical aspect of that is that when you have builders who are working on affordable housing, who incorporate the techniques and technology needed to achieve something like passive house, then that knowledge can be diffused, and communicated throughout that local housing market. The second example that we give is using the programs that currently exist in programs outside of affordable housing, such as utility incentive programs, to incorporate health impacts alongside energy insecurity and cost impacts when they're evaluating their program design. So there are many local government programs that use some kind of cost benefit analysis, and it would be a really great opportunity to incorporate health impacts into those frameworks as well. Next slide. The third category that we talk about is really about setting codes and standards. And this is an area where state and local governments have so much ability to make a difference. One of the really important takeaways from the health research is the degree to which summertime high heat events and heat waves are so impactful for health and disproportionately so for low-income people. And even in places like New York, where we have temperature requirements during the cold heating season, we don't have indoor temperature requirements during summertime. And so as we move into a reality where the buildings need to adopt protecting folks from high heat as a primary function alongside protecting people from cold, it would be a great thing to see indoor temperature requirements being adopted locally. And then secondly, a movement that's already underway, underway is the adoption of building performance standards. This is a way of, again, signaling to the marketplace that we need to change what we expect from the build quality of our buildings. So making those building performance standards account more explicitly for health impacts would be a great extension of that initiative in places where they've already adopted building performance standards. And to adopt building performance standards faster would also be in line with the need for faster climate action. And lastly, our fourth category, of course, is dealing with resources. And I think that anytime we're talking about providing housing for folks who otherwise wouldn't be able to access it on the open market, we have to accept that there's going to be a resource need. And so what I would in particular would love for the audience to take away from this report is that housing funding translates into health funding as well. And that, when we think about housing policy and where money is going, we want to avoid sort of zero-sum thinking where we say, well, it's either housing or other anti-poverty benefits or whatever. What we really need is a recognition that there's a lot of investment that's needed in housing, that these are interconnected issues, and that we ought to be fighting really hard for all of those resources. And then secondly, of course, there are existing programs that we could be using more flexibly if there was rulemaking that could happen, or sometimes legislative changes that could happen at the federal level that allows us to layer resources in ways that perhaps we're not able to do right now. And certainly, coordinating on those sorts of initiatives would be really beneficial for everyone. Next slide. And Yuan?
Thanks for that, Bomi. I would like to take us to our guided discussion segment for today. We clearly cannot afford to treat energy, climate, health, and housing goals separate and isolated from our broader social policy and equity goals anymore. And the level of transformation that is needed to achieve will require all hands on deck. And so joining us today are experts from the affordable housing, environmental justice, market transformation, public health, and healthy homes space. We have Ryan Cassidy, Director of Sustainability and Construction at Riseboro Community Partnership. We have Jamal Lewis, Director for Climate, Energy, and Health at the Green and Healthy Homes Initiative. We have Jessica Miller, Associate Director for Policy Strategy and Engagement at IMT. Carolyn Olson, Assistant Commissioner at the New York City Department of Health and Mental Hygiene. And finally, Yuva Vosper, Policy and Regulatory Manager at We Act for Environmental Justice. So my first question is to Ryan and Jamal. Both of your work is at the forefront of this kind of change in the healthy home space. In addressing housing quality and health impacts of housing, having been in this space, do you have any lessons that you want to share? Maybe Ryan can go first. And you're on mute.
There we go. Yeah, so I think our experience with health and housing started about 3 years ago. And we, first of all, Riseboro is an affordable housing developer, but we also do lots of social services from kind of youth and education all the way through seniors. So it's an important part of our mission to understand the impacts of housing and health. And so we got together with MIT up in Boston to develop a indoor air quality program 2.5 years ago, which was a little early and proved to be useful in both like thinking about ventilation rates during a pandemic and also indoor air quality. So I would recommend, just like we do with real estate development, bringing together the science side and housing and health into one place. And usually MIT was really excited to get a bunch of affordable housing units that they could put sensors into and understand data. And so the need on the science side is there. So anyone that is a property management company or real estate developer has access to these types of buildings where they can turn them over to the folks on the science side and then communicate results out to health. So in a way, it was a little bit like a real estate development project where we just kind of brought together the experts and produced data and let them look at it. So in this particular project, the goal was pre and post renovation for passive house tenant in place rehab. So right now we're starting to get into post construction data, but the 2 years of results that we've gathered really showed that the indoor air quality in these units, especially during gas cooking events, is really poor. And so it's essential that we get rid of all of these gas cooking appliances, especially in urban areas like New York that uses gas as the primary cooking fuel, and making sure that we can get turn healthier units when we have these financial moments and opportunities to renovate housing.
Thanks for that. Jamal, any thoughts?
Yeah, thanks for having me. I'm really excited to be here, and I just thank you for this wonderful report. I'm really excited about it because it continues to advance our collective understanding of what a healthy home really is, and it sets the standard for what we should be striving for. And I think it's really important that as we are continuing to advance our understanding, that we are also mindful that there are legacy hazards and pollutants that are still present in our homes today, and that are causing really negative health and social impacts. And so as we are in a National Lead Poisoning Prevention Week, I do really want to mention that Lead has been a hazard that we've known has been harmful, particularly to children, and disproportionately impacts Black and brown children. That those hazards still exist in our homes and are a tremendous barrier to achieving maximum and comprehensive benefits to limited income communities and Black and brown communities. So as we're looking to advance beneficial electrification, and we are continuing to advance our understanding of what a healthy home is, I really love the focus on comprehensive solutions, ones that, again, prioritize benefits for these communities and these households, and ones that should also include the addressing of some of these legacy hazards like lead, like mold, in the process. And so, and from our experience, that addressing those issues are what our clients are the most excited about when they're receiving home retrofits and rehab. So I just wanted to point that out, and thank you again for this wonderful report.
Absolutely, Jamal. Thank you both for sharing some ideas. So I'm going to move on to our next question, keeping my eye on the time. So as we put together this report, our goal was to make explicit this linkage between all these elements of buildings and health. And we wanted to demonstrate that these linkages are not imagined. These are the facts. So to Carrie, we would love to hear from a public health perspective and your work at the Department of Health. Are there still important questions about how buildings and public health interact that you feel are still unanswered or deserve more attention?
Thanks, Yuan. And I just want to say thank you to you and BOMI and RMI for putting this report out that really centers health equity as a critical component as we pursue climate mitigation and beneficial electrification. I think, when I think about this from a public health perspective, one of the things that the report does that I want to remind everyone of is the importance of not losing sight of challenges and also potential unintended consequences as we work to overhaul our existing clearly unsustainable systems and the housing market that we have. The report does a great job of outlining its scope and also referencing areas that require our simultaneous attention if we really want to succeed in a just transition. And I'm going to emphasize two of those. One is energy insecurity, and the other is thinking about health impacts of power outages. For energy insecurity, the report does a great job of naming the heat or eat dilemma and actually expanding it to include the idea of cool or eat, because of the need for safe, cool housing as our climate warms, which BOMI mentioned as well in her review of the report. And as we electrify our residential buildings, especially when we talk about affordable housing, we have to address the cost burden of energy for poor families. The economic impacts of the pandemic that we're all just coming out of has made this even more salient, and decades of disinvestment in affordable housing and racism in our country mean that people of color face the highest burdens here. At the New York City Health Department, we conducted a survey of about 2,000 lower income older adults, and we found that energy insecurity, which is the economic hardship of being unable to pay for your utilities, was an ongoing and very urgent problem right now for more than a third of residents who reported having difficulty paying their electric or gas bills. And this really contributes to poverty and poor housing quality, which are fundamental social determinants of health. So I think we really have to be thinking about that in any sort of health equity approach. And then that also brings me to this issue of grid reliability, which is also touched on in the report as another area that we have to think about. And this is really important from a health perspective too. So power outages have their own health impacts. Here in New York City, we had a citywide power outage in 2003, and research showed that there were substantial impacts on mortality, hospitalizations, ER visits. And we also know that small outages can affect the health of residents, both in warm and cold weather. And so I want to emphasize, I think that we can do this. The grid can be reliable, but we need to make sure that we're doing that in an equitable way. In New York City in 2019, there were brown and blackouts during a heat event, and those happened in communities that have the highest risk of heat-related mortality. And those were outages that were planned by the utility to protect the entire grid, right? And so as we increase electrification in residential settings, which does need to happen, we also need to make sure that our infrastructure is equitably handling any increased demand, because differential outages like that are only going to exacerbate the inequities that we're trying to address. So thank you so much.
Thanks for your great comments, very timely. So my next question is to Jessica and Yua. I'm wondering, as we think through how we can make this a reality that is scalable, accessible, and implemented, I'm interested to hear from each of your respective areas of expertise. What is the number one lever that you need in order to make this sort of a reality happen? And perhaps Jessica can kick us off first.
Sure. Thank you for inviting me to be part of this discussion. So working in the policy context at IMT, where one of the things we do is to support jurisdictions to design and implement building performance policies, I would say kind of, on theme with this discussion, we often see these sort of siloed approaches that look to target one problem. So reducing energy, reducing carbon, and then end up falling short because of the sort of complex interactions within our built environment that this paper does such a good job of unpacking. And while we've been discussing that these intersecting solutions are what's needed, one of the biggest challenges in our work is sort of figuring out how to break down some of these existing silos on the program and policy side, so we can leverage resources and expertise and not reinvent the wheel on things that are working. At IMT, we've been focusing more and more on building performance standards, one of the tools recommended in this paper. And I've been specifically thinking about how we can expand the reach of a building performance standard to touch on additional community priorities like health and climate resilience. We just released a brief recently outlining how to include indoor air quality metrics as an example. But one of the things that's really needed to get a policy like that to work is to get local government departments that are used to kind of managing their own kingdoms to work together and collaborate in ways that they may not have been asked to do before. But they'll need to successfully implement these sort of intersectional solutions. So relating back to what Bomi said kind of at the top of the call about creating a shared language and goals among different professional groups, that same thing is needed within local governments to make some of these kind of programs and policies really implementable and scalable and successful. And I would say, the same is true for shifting the ways in which governments work and empower community-based organizations, which I'm sure you can talk more articulately about. So I'll stop there. Thanks.
Thank you, Jessica. Well, at We Act for Environmental Justice, we work toward empowering communities so that they can be actively heard and make meaningful sound. And as stated in the well-written report, congratulations, you, Anne and Bomi. In New York alone, 84% of low-income homes use piped natural gas, propane, or fuel to heat units. And we know that low-income neighborhoods will benefit the most from these energy efficient investments. Yet, so many times, they are the last to gain any investments. And when we do get investments, it is quite piecemeal. So I'm kind of going to break it down into like state and federal. So on the state level for needs, we know that there is the Climate Leadership and Community Investment Act, which states minimum of 35, hope maximum of 40% distributed to low-income communities in ways that benefit them. In NYCHA housing, there's about 400,000 New York residents living in New York New York NYCHA housing. And these, the federal monitor reports there may be actually more numbers than that. And many NYCHA tenants have stated that they live in conditions, have malfunctioning elevators and faulty appliances. And NYCHA is doing a big push for weatherization. We have a program at WEACT called Out of Gas In with Justice, and it's an electrification pilot study. Well, we will be taking 40 households in total in Buffalo and New York City, 20 in Buffalo and 20 households in New York City. And we will be giving the households heat pumps and induction stoves. And from this electrification pilot study, we hope to gain information about quality air sensor, quality air monitoring, energy burden with bills, and just see how this is done in real time. And it's also to illustrate that low-income communities can be the first to get these investments, not the last, and that the people who benefited and needed the most can show a great improvement with these household appliances that, you know, just show there's value to quality of life. And on the federal level, we have a big announcement with the Build Back Better framework being released today. And these had some good investments, making the single largest and most comprehensive investment in affordable housing in history, giving rebates and ensure middle-class families save money as they shift to clean energy and electrification, addressing capital needs, ensuring that lead paint is removed from under-resourced neighborhoods and removing lead paint from hundreds of thousands of homes. And as it currently stands, the bill would provide critical investments in affordable housing, including new resources for public housing, housing for seniors and people with disabilities. Also, there's a $150 billion investment in housing affordability and reducing price pressures, including in rural areas. Also, if you did not know, Housing is Infrastructure is a bill that was introduced by Maxine Waters, and that would invest $75 billion to preserve public housing for current and future generations. But just not to go into all of these policies, just to show that our need is not just funding, but to show that with an infrastructure package and just not even in life, housing is not a supply and a demand kind of thing. Housing, quality housing where you can come inside and all your appliances are working, you have a good building envelope, your indoor air quality is, you know, as best as it can be, is a human right. No one should be exacerbated by a leaky oven or has to go to a cooling center just to get cooling. It shows that housing is infrastructure. Having a quality of life, a quality of housing, you have a stable place to go and you can get a job. You can have a job and come home. You don't have to worry about where you're going to put your head. All of these things are vital to society. And in closing, what we need is not only, you know, funding and awareness, we need investments. We need to be able to recognize how disadvantaged communities have been historically disinvested. And we need to also realize that housing is a part of infrastructure. We need housing, we need people in homes, and that's also how we can boost jobs in the economy.
Thank you, Yua. Okay, I am keeping eye on the clock and we don't have a lot of time, and I want to keep enough for our Q&A section. I know that we're going a little crazy in the little box. But so my last question I'm posing to all of you speakers, you know, one of the biggest hopes that we have for this report is to find common ground between areas that traditionally have worked rather separately from each other. So my question to all of you, and I'm giving you 1 minute each to round out this part of the discussion, is given your own very specialized expertise, what is something that you want some of our other friends to take away from this? What do you want somebody else on this panel to learn? And let's start with Ryan, Jamal, Carrie, Jessica, and then Yua.
Sure. So I think it's really almost a developer mentality of bringing together these different groups in health and housing, and starting those conversations, because they are groups that don't typically interact. And I think if you're here today, you probably believe that health and housing are kind of fundamental rights that go together. And so starting those conversations from your developer, if you can do it, in your owner and your local like affordable housing, and really the way to do that, because there's big budgets, especially in new construction, and to spend some extra money, you can get a pretty good indoor air quality study for probably under $20,000, which isn't going to break any new construction budget. So developing data streams on indoor air quality and starting to link health and housing, I think is the most beneficial next steps.
Yeah, so I want to emphasize that in order to really maximize the benefits for limited income communities and Black and Brown communities, we really need a comprehensive approach, and we need to ensure that these communities have what they need to transition first and foremost, in order to maximize these benefits. In order to do that, we need resources, we need funding, as has been mentioned and highlighted by many of my co-panelists. And the federal government and other state and local governments can be really helpful in doing that. But there are also other partners that can be helpful. So we've been looking at and have been a part of some really groundbreaking announcements with the Penn Medicine Lancaster General Health system, a health system in Pennsylvania that's going to be putting forth $50 million to eliminate lead poisoning in the county, in Lancaster County. And we're a part of a 7-city initiative being launched by ProMedica, which is a health insurance company that's also looking to invest in improving the quality of existing housing. And both of these are examples of ways in which the healthcare industry, recognizing that housing is a social determinant of health, are going to be leveraging their resources and their footprints to contribute to this ultimate goal of making sure that we're able to achieve the highest standard of healthy housing that includes eliminating health and safety, that includes weatherization, and that includes electrification as well.
Great. So I agree with all of that, and I would just also add that I think it would be great if we could be centering the health of overburdened and under-resourced communities in our climate change mitigation efforts. So the report references the importance of doing that, and I'd love to see us actively involving communities in these solutions, so that we're doing true equity-focused community engagement, beyond just informing communities about what's going to be done in them, or just listening sessions without action, but actually involving them in the work, which I think is a way to make sure that we're undoing previously oppressive systems and really making change with the folks that we need to be supporting. Thanks.
I think I'm next. So I think, just building on what's been said, what I hope people take out of this report is that creating these holistic solutions that touch on the multiple kind of urgent problems that we're facing right now is a requirement. So there's kind of a phrase that you hear sometimes, like, all solutions need to be climate solutions. And I would, shift that a little bit to say, like, every policy now needs to be intersectional in this way that's kind of described in this paper. Otherwise, we're kind of just perpetuating some of the systematic breakdowns that we're kind of dealing with and that have been talked about today. So we need to kind of prioritize, interventions that tackle, multiple challenges at once. And we have to kind of bring the frontline communities in and empower them to really chart the path forward. So I'll stop there. Thanks.
I hope I'm next. Yes. So for me, I think we all know what needs to be done. We talk about it all the time. I think we need to start doing it and put that into action. And I also want to pinpoint, and I like that it was pinpointed in the report, in the indoor air quality aspect. Frontline communities are the first and the worst. They're the first ones to receive the worst types of pollution, because as was stated in the webinar today, many frontline communities live within or around industrial facilities, water waste plants, gas pipelines. So if you are outside and you are breathing toxic air, you are also going inside and you are breathing a leaky gas oven. Your windows are not properly insulated, and other pollutants. Indoor air quality is not regulated. So to wrap it up, I want to kind of highlight that indoor air quality is a big component of housing and housing comfort and housing health and safety, especially in low income communities, because as Jamal said, many Black and brown people do suffer the most from asthma.
Thank you all for the compelling feedback, ideas, thoughts shared. We are at time, and I would like to remind everybody that our recording will be uploaded and shared out along with the Q&A box that has been very active, and all the questions seem to be answered already. We'll be sending that out together with the chat box so that everybody is able to access this. Thank you so much for your participation, listeners. Thank you, speakers, for your wisdom and your empathy and your energy. I hope that this is not the end and that this is just the beginning of more intersectional and equitable climate action. Thank you.
Thank you.